we've heard from two of the speakers about the brain before, and arguably it's really the most precious organ I think that we have, that sort of defines who we are, our identity. And as you know, there are diseases such as Alzheimer's disease, but many psychiatric diseases, as Leanne mentioned, that rob us of this our own self, basically. And this supercomputer takes about 30 years to be built and function at its highest capacity. But even as it is being built, it starts to age, as Eric told us yesterday. We start to age very early on. And as the brain gets older, it becomes much more susceptible to these age-related neurodegenerative diseases, most prominently Alzheimer's disease. So I just put a couple of numbers out here. At age 65 or so, 3 to 5% of the population suffer from cognitive loss that is clinically defined as dementia or Alzheimer's disease. And above age 85, it's roughly a third of the population. And that keeps increasing as we get older dramatically. So Alzheimer's disease is a very dramatic disease, as I mentioned. But what we need to understand is that within our body, not every organ ages at the same rate. And I put this slide up here to illustrate this. So if we start on the right-hand side, we see 4 hypothetical people. And these people age at different speeds as they accumulate years of life. And we do this sort of on a regular basis. When we look at a person's face, we often estimate how old they are, right? But they're not necessarily as old as we estimate. We, of course, only tell them if they look younger, and usually not if they look older. But you can have people's skin, for example, aging faster or slower than their heart or their brain. But most of the time, we actually don't know which organ ages at which rate. And within a given organ, you can have the cells, the individual units that build that organ, age at different states. And we know that the molecular basis of this aging is being elucidated. As Eric told us yesterday, we know more and more about the basic fundamental processes that lead to cellular aging. And then we go from left to right now: cellular aging, organismal aging, and then aging of the entire person. But so you cannot give the age of an individual with one number, like some companies do, because you wouldn't know whether you have a young heart or a young brain in that individual. So the approach that we took is basically a copy of what you do if you take a regular blood test and do clinical chemistry. Right now, if you go to the doctor and you have your blood drawn, we measure 50 to 100 different molecules. Very few of these molecules are proteins derived, for example, from the heart, that are used to diagnose heart disease, but not very efficiently, as we just heard from Jim. We have proteins from the liver that tell us whether the liver is functioning, but often these proteins that we measure, the very few that we measure, or any of the other tests in this regular clinical test that you get from the doctor, they get very limited information about the future of your body and how it's aging, but rather on pathological process, whether you have an organ that is already sick and is not functioning well. So we took this approach and we measure in the blood of an individual proteins that are derived from different organs. So there's proteins in your blood that are derived from the brain, from the heart, from the lung, from the liver, and so forth. We use this, for example, to diagnose diabetes. You measure insulin that comes from the pancreas, and that tells us whether your pancreas is functioning and whether you have potentially diabetes. So we took this approach on steroids and measure now thousands of different proteins that are derived from different organs. And that allows us, using machine learning, to estimate the age of your organ for all of your major organs in a living person. And what we get then is, as you see in this diagram in the middle, you get the actual age of the person, which we call chronological age, and then we can estimate for each individual organ how old is it. And the difference between the actual chronological age you have and the predicted or biological age is called an age gap. Remarkably, this gap is a very strong predictor of future disease of that organ. So if you have a high heart age gap, you're going to have a much higher chance to get heart disease. What I show you here is if you have an older brain, you have a much higher risk to get Alzheimer's disease. In fact, if we look at the people, in 50,000 people from the UK Biobank studies here, we find about 1.54% of people who have much younger brains, so they're at the very tail end of the normal distribution that we can see in the population. And we compare these to people with the oldest brains, roughly 1.2%, so these are 1.5 standard deviation at the end of the distributions. There's almost 20-fold difference in your risk to get Alzheimer's disease 10 to 15 years later. So these are data that were collected from people at time zero, and then 15, 20 years later, we know whether they developed the disease or not. And so we can do this for many different types of organ-specific diseases. We can predict heart disease, we can predict kidney disease, and so forth. And so what we want to do is we started a company called Vero together with Paul Coletta here, sitting in the front, and Marcus Ockemus, a friend of mine, where the idea is that we get a blood sample from a person, we measure these organ-specific proteins in the blood, we use the machine learning that we have estimated now from tens of thousands of individuals, measure the age of each of your organ, and then with input from a physician who has knowledge about these different organs and potential interventions, we help you to address for example, an advanced age of your heart, of your liver, of your brain, and then we can test you again to see whether the effect or the intervention has an effect. And so the idea is really here to prevent diseases on a personalized basis and have an intervention that works for you and not just for the population as a whole. And so with that, I'd like to thank you for your attention.
Yes.